Hi, I'm Dr. Rob Rutledge. I'm a cancer doctor here at the Cancer Center in Halifax. And you're watching this video because you're either started on or about to start on hormone treatments for prostate cancer. And I want to give you an overview of the side effects you might expect and the things you can do to really help yourself and to make a difference in your health in the short and long term. I'm drawing on a fantastic book called Androgen Deprivation Therapy by Drs. Westerstug, Walker, and Robinson. Highly recommend that book because it takes you through and gives you the detail and the activities in the program that can really make a difference in your health. But I wanted to talk about what is hormone therapy, how it works, give you an overview of what to expect as you go forward here. So hormone treatment is also called androgen deprivation therapy. The idea is that we give you treatments either in pills or injection forms that decreases the levels of testosterone in your blood. Testosterone is the male hormone, and the way to think of it is that the prostate cancer cells feed on the testosterone. If we get those levels down very, very low, then you essentially starve the cancer cells and you get at least a 99% cell kill in most situations. Your doctors will have gone over exactly how they're going to prescribe it. Sometimes it starts with a few weeks of a pill and then an injection. The injections can be given monthly, every 3 months, every 6 months. They're given in different ways. But your doctors will go over that. Sometimes the hormone therapy is given for a short period of time, for instance, 4 months, 6 months, 18 months, a couple years around radiation treatments. Sometimes it's given indefinitely beyond those hormone therapy for the rest of your life. Firstly, I want to go over the side effects of the treatments because if you drop down the testosterone within a man's body, you're going to have physical things that happen. And one of the things that happens is hot flushes. And at least 80% of the guys that have hormone therapy will get this kind of feeling of being very warm, flushing, last 2 or 3 minutes. They may get sweats at night. That's the kind of expected thing. It's very much like women going through menopause, the kind of change in hormonal therapy. And this can obviously disturb your sleep is other kind of physical side effects and the fatigues and the issues that are related to that. Next is the bones can actually get thinner over time because testosterone helps to kind of maintain the strength of the bones itself. So the bones get weaker with time. And it's one of the reasons that you absolutely have to be on vitamin D and making sure you're getting enough calcium in your blood to kind of mitigate against that. I think about when your testosterone levels go down, I think about it kind of like your metabolism slows down. And so men are really at risk of gaining weight, so they kind of get more fat in the mid area. And also at the same time, their muscles can get thinner and weaker. So again, I'm outlining these things because there's things you can do to mitigate against that. There's other chemical things that can happen within the body. So the blood sugars can go up, the fats in the blood can go up. There's something called a metabolic syndrome where the fat within the waist area increases as well. And it really puts you at risk of heart problems, diabetes, other problems related to the obesity side. Your blood cells, the red blood cells can decrease. You can hear that as anemia or a low hemoglobin. It's all the same thing. When that drops, that can also add to fatigue or some slight shortness of breath and activity and so on. The breast tissue can actually grow a little bit. It's a kind of change in the hormone therapy. It happens to some of the men. You get shrinkage of the penis is another possibility, of the testicles. Guys also have a little bit of hair loss as the testosterone levels go down. So it's not going to happen to every guy that this happens, but I'm giving you kind of an overview of all the things that could possibly happen. So now some advice, some practical things that you'll kind of figure out over time. So around hot flushes. So one is what you do in the midst of kind of breaking out into a sweat or feeling too hot and so on. So if you happen to have a cold towel, you can kind of cool yourself off, dab yourself down, or sometimes there's a fan available, or you can fan yourself, open up a window, get outside. Or you might have to kind of take off a layer of clothing. So in that moment, you kind of adjust to what's happening. On an ongoing basis, if you know you're kind of having hot flushes, several times a day, or hot flushes are waking up at night, there are other things you can do to kind of help yourself. And so the list that I'm reading from: dress in layers, so they can kind of pull off that. Same thing at nighttime. You want to maybe have several thinner sheets so you can kind of pull back those sheets, or put down a towel on your bed if the sweating is more pronounced. Quitting smoking is obviously something we want you to do anyways, but it seems that smoking can provoke hot flushes. Sometimes certain foods can provoke it, so if you notice spicy foods, you want to might eliminate those from your diet. Keep your room at a cooler temperature, opening that window at nighttime. Use more breathable clothing. And the last thing is to avoid the very hot showers or baths, and just go to kind of a warmer, lukewarm temperature to take away the provocation. You'll figure out your triggers and be able to try to avoid those, and figure out the activities. For instance, like practicing relaxation technique that can actually decrease the chance they kind of flush and so on. So those are the kind of day-to-day. If it's persistent and affecting your quality of life, you really need to talk with either your family doctor, your urologist, radiation oncologist, the person who prescribed the medication. There are different treatments, like different medications. For instance, there's an antidepressant that kind of changes how the hot flushes work, called the Effexor. And there are other kind of medications that you can try and use, and so on. There's actually randomized data that show that acupressure decreases hot flushes. And lastly, there's the relaxation breath, the abdominal breathing. It's like you're settling down the kind of nervous system, and so you're not as reactive towards the triggers for the hot flush itself. The next thing I want to talk about is the fact that your bones can get thinner. It's also called osteopenia or osteoporosis, depending on the severity. And so therefore you're at risk of fractures, and particularly the backbone can kind of get a little collapse around it. So all men are at risk of that. It's just that the guys on hormone therapy, can decrease the strength of the bones, or the integrity of their bones over time. So when you're starting out in your hormone treatments, just beforehand, or within the first few months at least, you should get a test called a bone mineral density, which is essentially like an x-ray that sees how thin your bones are. And so your family doctor, your oncologist can watch that as a baseline and see if you're dropping with time, or if you're too low to start out with, they may actually add a bone builder at the start of all this. You need to take your vitamin D every single day. It's 1,000 international units per day, along with enough calcium. You want to maintain a reasonable weight as well, because if your bones are thin, you got too much weight, you might be putting too much pressure on your hip, for instance. There are treatments. Sometimes the treatments come as a weekly pill. Sometimes it's an injection. Guys that have been on hormone therapy for a long time can get something to kind of boost the integrity of the bone over time. You need to ask your physicians about that. Lastly, if you're having dental work, tell your dentist that you're on hormone therapy, because it's a very rare complication where they get a breakdown of the bone around the tooth area. Okay, so the other big one that happens, hot flushes, thinning of bones, but it's actually kind of weight gain or thinning of the muscle. So you get physically weaker. Luckily, you can actually exercise to change that dynamic. Exercise and diet, you can actually maintain a reasonable weight, and you can actually build, or at least maintain your muscle mass and your strength. Again, rely on the experts. I'm always looking to, is there a physiotherapist within the cancer system? Do you want to get a personal trainer? Can your family doctor offer you some advice? You want to continue to tap into those resources to empower yourself. The guys that are on treatments need to chat with somebody. So exercise, especially for guys in hormone therapy. You still want the aerobic side, so getting that kind of heart rate up 30 minutes a day, 6 days a week. So you're building yourself up to that, because that gives you strength and energy that mitigates or goes against the fatigue that you can suffer. So Energy size is the cardiovascular, getting yourself to that kind of shortness of breath, that kind of slight sweat on the brow type thing. Secondly is strength training. So you're actually pushing the muscles so they respond by getting stronger. Third is weight-bearing exercises. So when you stress the bone a little bit by walking, changing, doing the kind of squats and so on, the bone reacts by creating more bone cells and getting stronger. And lastly, just flexibility, balance. You want to do those things as part of an exercise program anyway. So you want the full meal deal in order to maximize your function and your cognitive abilities, et cetera, et cetera. So the general advice around exercise is that you want to work your way up to and go beyond the recommended 150 minutes per week of exercise. And you want to do it as vigorous as possible. Your training gets stronger and stronger. The harder you work, the better the benefits in terms of the prostate cancer side. Doing something every day is better than nothing. Doing more is better than less. But I also say make it fun. You want to continue to do this. You're likely going to be with us for many, 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 many years. And so you need to continue to exercise and be strong, even if you're off your hormone therapy. And so make it social and so on. So exercise and diet, I can't emphasize enough those two in combination. And the dietary advice, big picture, is at least half of your plate is vegetables and a little bit of fruit around that. And then you have the healthy protein, the healthy fats, and so on. But at least veggies is super important on that side. I always say, again, see a nutritionist. Go into the cancer center. Talk to an expert. They'll assess your diet. They'll make recommendations for you. You slowly want to integrate those changes into your lives, introducing the healthy foods and decreasing the unhealthy stuff. And it's a whole talk in and of itself, but I just want to give you some of the principles around that. So you're reducing the red meats, the processed meats, the junk food, the salty, fatty stuff in your diet. You really want to cut back, especially the kind of pop and sugary juices and so on. You really have to cut back on that because of the risk of diabetes while on hormone therapy. And then you want to be introducing more and more the healthy stuff. And so we think about the healthy fats, avocado, nuts, omega-3s is part of the fish, the cruciferous vegetables, broccoli, cauliflower. Those things actually have anti-inflammatory effects and kind of rebalance the sugars within your blood itself. Take your vitamin D. Enjoy eating. Enjoy the kind of connecting with family. So, and get to see the expert. So exercise, diet, two things around the kind of too much weight, not enough muscle in your system. There's also the psychological effects of hormone treatments, and again, it's different for each person, but just think about it. When your testosterone goes down, it actually changes the chemistry within your brain and how your brain thinks. And so you can actually be at more risk of a kind of emotional lability, kind of up and down. So depressions, people can feel more angry, irritable, upset, can be crying at commercials. It's just like, it can really kind of change your system, and that can kind of be distressing by itself. So the psychological stuff is normal and expected, and it's one of those things where, again, if you're really feeling the difficulty, go see a professional around that. There's a slight decrease in your kind of ability to think and remember. It's interesting that the kind of three-dimensional ability to think might be take a bigger hit, but you might find your memory is not quite as good. Lastly, from a psychological perspective, when you start hormone therapy, you're losing these other aspects within your life, and you can kind of feel a sense of grief and loss. Again, normal, expected, just guys go through that, and again, reach out to the professionals if need be. Lack of testosterone leads to lack of sexual function, essentially, and it happens in two ways. One is you lose your interest in sex. Almost all guys, some guys maintain it. The other one is almost all guys lose their erections as well at the start of hormone therapy. This video can't capture all of the kind of advice around that, but there are specialists within the teams. They have like sexual dysfunction clinics that you can go to and try to figure out how to work with it. And that kind of intimacy and connection and meaning within your life really transcends the kind of penetrative sexuality type thing. You can kind of have that kind of intimate connection in different ways. So really big picture is by choosing to empower yourself, you can make a huge difference in your health and your happiness and really mitigate against the possible long-term side effects of the therapy. So thanks for watching this video and take care.